Yeah, you're welcome to this episode of Ask Dr. Ken. On this very episode, we have a lot of interesting guests, I must say, and they're all functional part of a unit, reproductive unit in Alps Hospitals and Diagnostics in Jos, Nigeria, West Africa. And right to my far right is an embryologist. His name is Mr. Paul Shoji. Paul, you're welcome to the show.
Yeah, thank you very much.
And next to him is an IVF nurse, Ruth Ogogo. You're welcome.
It's a pleasure to be here.
And next to her, we have the baby dragon. Ayomide is a medical student in one of the colleges of medicine in Nigeria. You're welcome to the show.
Nice to be here.
And very next to me is a big man. He's a consultant gynecologist.
You are big guy.
He's a consultant gynecologist. He's a fertility specialist. You know, and been interesting working with him. His name is Felix Elachi. You're welcome. And I'm Dr. Kenneth Eguda. I'm an IVF specialist and a minimal access surgeon. And so
the chief dragon.
No, we are reproductive Nigerians. That's what we are.
Oh, yeah.
All right, thank you. You're welcome to the show.
Recently, I was at the hospital and this woman walked in. She came in and she was manifesting some certain symptoms, and one of them being irregularities in her menstrual cycle. So we took her in, the doctor saw her, and they found out that she was having or manifesting symptoms of PCOS. I don't know if it's possible for us to shed light on what PCOS means.
PCOS.
Interesting.
Well, PCOS stands for Polycystic Ovarian Syndrome. That is what it stands for, and it's an endocrine disorder. You know, by endocrine disorder, it means abnormalities in reproductive hormones and all that. And by it being a syndrome, it means you have to have a collection of symptoms before you arrive at.
So you see, it makes a lot of women come with different presentation. You know, it's a disease condition that has multiple ways of presenting itself. To some women, they have excessive body hair, but it's good to know that not every woman with excessive body hair has polycystic ovary.
I think it's one of the most commonest challenges that women have within reproductive age, if not the commonest.
Yeah, I agree with you. It's actually the commonest endocrine disorder among women of reproductive age, and even now, the presentation seems to be changing because we tend to see it a lot more in younger age females and in teenagers. And a lot of things. Yeah, a lot of things. The last time in the clinic, I saw a 14-year-old girl, with already frank features of polycystic ovary, and her parents were actually very concerned. And the pattern of eating of this generation, the dietary pattern actually lifestyle plays a lot of role.
So let's say lifestyle affects this particular, or it's one of the major causes of this clinical condition.
Sure. Actually, the cause is unknown, but really there are risk factors, and those risk factors could be hereditary. And then yes, that's one of the.
I tend to agree with you.
Now I agree. You see, like just yesterday in my clinic, I saw a client with polycystic ovary. She's been married for like 7 years and has not been able to achieve conception. And she told me her mother had polycystic ovary. She doesn't even menstruate except once a year. But then she was able to conceive and give birth to about 4 girls. And right with her was her younger sister, who also had PCO. So it actually has a lot of genetic correlations. You know, it's a mother is likely going to give her the female kids she has.
Also, one thing with this polycystic ovary, I think there's also hormonal imbalance too. Yes, where you have high androgens in it, and then that's also.
You know, the other time you were talking about lifestyle. Some weeks ago, I was searching the literature and I came across a study that was done among rabbits, where rabbits were fed with special feed preparations for poultry beds. And it was a sort of a cohort study where they have a cohort of a group of rabbits that were fed on that particular poultry feed, and another group that, were fed with something different. So they found, after some time, they found out that, rabbits that were fed on these poultry feeds, they tend to have multiple cysts on their ovaries. So the study actually concluded that it's likely that the consumption of poultry products may predispose to polycystic
and another thing with PCOS is that there are a lot of immature eggs in these follicles. That's one of the symptoms in PCOS that makes pregnancy very difficult for a lot of them that come down with PCOS. So what really brings those people that have PCOS to come to the hospital to seek to get pregnant and all that?
Yeah. For my observation is that most clients I see, coming with PCO, usually have reproductive challenges. It's either they're having difficulty with conception,
yeah, it's very common,
or they're having recurrent miscarriages,
yes,
or having abnormal or excessive menstrual bleeding, or no menstruation at all.
Yes.
So that's the common things that brings them to the hospital. A few of them come because of acne, and excessive body hair. So those are some of the ways people with PCO, polycystic ovary, present, but a good number of them present with reproductive challenges, and that is a very big challenge among those with polycystic ovaries.
So apparently they have problems with ovulation. In PCOS.
Yeah, so
I think that being said, what does it really take now for a woman, a PCOS woman, to get pregnant, having spelled out that it's a major cause of infertility? So what can be done?
How can they be helped here?
Yeah, there are a lot of ways you could help PCO, but it's good to mention that a good number of women having PCO actually conceive spontaneously and would carry their pregnancy to term and have a very good and easy, successful delivery without complications.
So should we say it depends on the severity of the condition or what?
Yes, I was going there. It depends on the grade or the part of the severity of the conditions.
They talk of phenotypes now.
So that means some of them might have PCOS and they might not be symptomatic.
Some people have PCO and are not symptomatic. Now, but the difficulty with conception, for instance, depends on the phenotype of the grade of polycystic ovary she's having. We have some literatures that have classified them into 4 phenotypes: phenotype A, phenotype B, C, and D. C and D phenotypes, for instance, are the worst categories of PCO, where you have a lot of hormone abnormalities, and getting them achieve conception could actually be an uphill task. So while some women conceive easily, some will need ovulation induction, for instance, and they meet with their husband. If their husband is in good reproductive health state with good sperms, they could achieve pregnancy without much support. Some will need ovulation induction, as I said. Some would actually need other procedures in gynecology to help them. Some of the procedure could actually be ovarian drilling, and that's something that we do a lot in our
recently, someone brought testimony, was it yesterday or so, that she was so excited with the ovarian drilling that was done that her period has become regular, like 2 consecutive times.
Really?
So that's a good one for ovarian drilling.
In polycystic ovarian syndrome, what happens is that the ovary is large. The ovary is larger than that of a woman without polycystic ovarian syndrome. And of course, that large ovary, what happens is that the environment of that ovary tends towards that of the environment there is predominated by male hormones.
Yes, true.
Male hormones, that is androgens, and that is why patients with polycystic ovarian syndrome, they tend to have excessive growth of hair on their bodies. The pattern of the hair growth is that of a male, and it's because of that imbalance. And apart from that, it's also mentioned that they have difficulties with ovulation and all that. Also, that androgenic environment, it's if I may use the word, toxic to those follicles there, and that is why you know, when you during IVF, when you get some follicles from patients with polycystic ovarian syndrome, they tend not to be, you know, viable.
Yes.
So now that you've mentioned IVF, actually, that brings to mind that a lot of patients with PCOS, for instance, will need IVF and other assisted reproductive modalities to achieve pregnancy.
Okay.
But the most challenging thing about them with IVF is that some may not even respond to IVF medication. As we said, depending on the grade of the phenotypes of polycystic ovary that have been diagnosed with, some will respond excessively and produce a lot of eggs
with
and even
low
have
quality.
a tendency of going into ovarian hyperstimulation.
Yes.
You know, then the challenge is the quality of the egg often.
Of course,
You have
yes.
very poor quality of eggs. And a good number of them actually have what we call empty follicle syndrome.
Yes.
They respond apparently, but the follicles are empty,
Yes.
all because of the degree of polycystic ovary they have. Then because of the poor quality of eggs, they find it very difficult to achieve pregnancy, even with IVF. So, and then it's going to be challenging to even find out that good number of these clients with polycystic ovary will need IVF with egg donation.
Yes.
Okay, I think I need to get a clarification here. So, people with polycystic ovaries, you made mention that they could be poor responders.
Yeah.
So, and then at the other end, you said, or they might be, they might have hyperstimulation syndrome. So, is it that people with PCOS can, like which of these in particular, rather, is it the hyperstimulation or the poor response? Like, where do they really fall to, or do they, depending on their category, they either fall on the left or the right or the high side?
You know, now it depends still on the hormone abnormalities that they have and the amount of ovarian cortex that they have, which, as I mentioned, predispose them to having a lot of male hormone androgen environment. You understand? So those are some of the things that control the pattern of presentation. Yeah, but from our local observation, a good number of them may tend to respond excessively to medication. You have a lot of follicles during IVF, but a good number of them are also empty of eggs. You understand? Then,
so I think they are more of or let me say they are more to respond at the high side rather than
yes. But
just that the quality might be the quality of eggs
also
produced.
have poor response.
Yes.
You have no response coming from them altogether, because of the degree of the polycystic ovary they have. You know, so
Sometimes
Okay,
it
so
can be
you
highly
mentioned
follicular.
the little girl that was about 14 years that had signs of PCOS. It got my antenna blinking because I'm like, what? So, what can girls growing up, what can they do to prevent themselves from having that in the long run and even?
Okay, you see that, as we said, lifestyle actually plays a lot role in polycystic ovary. You know, he just mentioned a case about feeding of animals with estrogen-containing diets and all of that. You know?
And that's what the poultry feeds actually contain. They contain a lot of steroids.
Exactly. So their diet and their lifestyle has to be modified. These days, we have a lot of girls and who are having a well-fed lifestyle, born into very comfortable families, and you go to secondary school, for instance, you see a lot of them looking a little bit chubby and obese. Yeah, they look good. Everybody likes to see his kids looking so fine and healthy, but most of the diets they are fed with predispose them to having polycystic ovaries. You know, I have a daughter, for instance, who is getting into the teenage age, you know, and of course, as a reproductive Tigerian, I can't watch all these abnormalities happen. So I sit her down, we do studies together, we listen to researches together, and I'm glad she understands. I used to feed my kids a lot of eggs, but as I speak with you right now, I don't know the quality of feeds that these birds are fed on in Nigeria, for instance, before selling. So they are unrestricted egg consumption. They go more on natural foods. I keep them a little bit active. As you're walking into the house, sometimes you see their shoes, their exercise shoes outside, and a little gym at home for them to work out and burn some calories. So lifestyle has to be modified. Even there's a relationship between excessive sitting and watching on television and make them sedentary. and predispose them to all of these things. So little girls growing up should eat healthy, a lot of vegetables in the diet, keep the lifestyle a little bit healthier, physical activities, and that way I think consumption of refined foods, meat pies, ice cream, donuts, and is it pizza? You call it pizza? Yeah, parents should regulate this so you don't have a generation of people with a lot of polycystic ovary that may predispose them to having fertility challenges. And you know what? Whenever I see people, maybe because of my training or my obsession, I always think first reproduction. Even on kids, I think reproduction. So that may be bad, but I'm wired that way.
So when do you suggest ovarian drilling to a client that has PCOS? When do you suggest that?
Okay, now you see.
When do you recommend it for them?
Usually, you don't just see them and walk them for IVF, depending on the circumstances. If the male partner seems okay, the sperms are okay, and you have done the first line of treatment, which is ovulation induction, and it's not working, you could add the second step may be to offer ovarian drilling if she meets the criteria for ovarian drilling. Having adequate size of ovary that may require ovarian drilling, you could do that and give her opportunity to ovulate by herself and achieve conception. Ovarian drilling also corrects, as we said, the hormone imbalance because it chops off the cortex that cause abnormality in the polycystic ovary. So if you offer her that, and that doesn't also work for her and correct some abnormality, then of course you could go for IVF. So usually there is a step you go. One step, second step, third step. Except of course if the client requests that I just want IVF. As you see a lot of them, they wasted a lot of time, and time is not on their friendly anymore. They just come to the clinic. All I want is IVF, of course.
So now for a young lady that just says, okay, I'm having irregularity in my menses, and then she has been diagnosed with PCOS, and she says, okay, I've heard that ovarian drilling can help correct these things. Can she be allowed to go through that?
Of course.
So apparently it can be a means to help her see if she would respond to having irregular menses afterwards.
You know, and that doesn't just help her having regular menses. It helps people having to regulate their menstruation. Just as you said, the client is all. Incidentally, I saw that client too. You know, she was very happy she had ovarian drilling. Menses have become regular and a lot of other symptoms were getting improved. For the young girl, for instance, it doesn't just only help with menstrual abnormality. It helps her with regulation of ovulation and quality of eggs. And because the eggs are trapped in a particular stage of development, that 3, 6 months or 1 year of no menstruation means no ovulation. And these antral follicle counts, they have so many of them trapped at the same level. So they ovulate bad eggs. So all of that, the drilling, helps in most of the symptoms. It reduces the androgen, so that's so you can improve with the hair distribution. It improves in the menstrual flow or menstrual pattern. It also improves in conception with respect to ovulation and sustenance of pregnancy, because one thing we haven't mentioned here is that they have recurrent miscarriages. So that also helps with correction of recurrent miscarriages. They also, when they're pregnant, they have abnormalities with antenatal period. BP control is a problem. Sugar control is a problem.
Insulin intolerance, resistance, and all that.
So we can go on talking about polycystic ovary. It's actually a menace.
Very common,
with all kinds of presentation. You know,
like 5 in 10 people, sometimes 5 in 10 women PCOS, and I'm like,
young women.
This is so common.
Exactly. And so going forward, we're looking at a future where PCO can be cured. You know, I'm very futuristic. Yes, I'm very futuristic, and I'm very fanatical about the future of reproductive medicine, not other kind of future. Yes, we're looking at a future where polycystic ovary can be cured by genetic modification and genetic editing. That's the only thing that seems to be, that has a prospect of curing PCO, where the gene locus of patients having polycystic ovary can be timed and locked up, just like a switching of light, you know. I like that kind of stuff. You inject a genetic editing material into the human body, and it gets there and deactivates the gene,
yeah.
because we establish it here.
Yes,
that
that it's
it's
hereditary.
related.
Yes.
So you could lock up that gene and know any manifestation of PCOS.
Or you can simply identify the abnormal gene, cut that segment off, and bring the normal segments together.
Exactly.
We're talking CRISPR, and then we could do it the IVF way.
Oh yeah.
You do the IVF, you do a gene analysis during the IVF treatment cycle. Then you introduce your CRISPR, and it knocks off the abnormal gene for polycystic ovary and replaces it with a healthier gene.
In such way, it will be hereditary.
Kids have a future without polycystic ovary.
That can be transferred also to their offspring.
Oh, sure.
Of course,
so we can talk about genes and there is no end. To those of you watching, this is where we have to stop this talk. This talk is in no way exhaustive about polycystic ovary. Polycystic ovary is a world of its own, and there's no end to talking about polycystic ovary. There is no end to the way it manifests, but the beauty is this: it can't be managed. Then there is a prospect that we could have a cure for a polycystic ovary. I look forward to that future because I'm working on that future as a matter of fact. And we have to stop this show at this point. Until we see you in our next episode of Ask Dr. Ken, just keep eating healthy.